Assalamu alaikum. I am Dr. Farhana ahmed Ela in Department of Pharmacology. Today I discuss very important topic, Introduction of Autonomic Nervous System. Now we start. Nervous systems are two part, peripheral nervous system, central nervous system. Central nervous system again two part, brain and spinal cord. Peripheral nervous system in two part, somatic and autonomic. Autonomic system have two part, parasympathetic and sympathetic. What is autonomic nervous systems? The word autos means self and nous means governing. The autonomic nervous system is one which is not under voluntary control. Autonomic nervous system is a major involuntary unconscious autonomic portion of nervous system. Unconscious body functions such as all exocrine and some endocrine function, heart rate, blood pressure, some metabolic function. Now I discuss functional division of autonomic nervous system. Number 1, sympathetic or adrenergic. This include thoracolumbar origin, response to stress, fight or flight, main neurotransmitter, noradrenaline, adrenaline. Number 2, sympathetic or cholinergic nervous system. This include craniosacral origin, homeostatic function, main neurotransmitter, acetylcholine. Number 3, enteric nervous system, control gastrointestinal function. This diagram shows sympathetic versus parasympathetic. Sympathetic or fight or flight, increase blood pressure, heart rate, glucose, perfusion to skeletal muscle, mydriasis, bronchodilation. And parasympathetic, rest and digest, meiosis, decrease heart rate, blood pressure, bronchosecretion, insulin release, digestion, excretion. This diagram shows the feature of some sympathetic and parasympathetic. In sympathetic, summary of response, in sympathetic fight or flight, in parasympathetic rest and digest. Spinal cord distribution, in sympathetic nervous system, thoracolumbar, in parasympathetic, craniosacral. Preganglion neuron, in parasympathetic short, parasympathetic long. Preganglion neurotransmitter, in sympathetic acetylcholine and parasympathetic acetylcholine. Postganglion neuron, in sympathetic long and parasympathetic short. Postganglion neuron transmitter, in sympathetic noradrenaline in most cases and parasympathetic acetylcholine. This diagram shows the function of sympathetic and parasympathetic. Parasympathetic on eye, constrict the pupil, on salivary gland, stimulate the flow of saliva, on heart, slow heartbeat, on heart, on lungs, constrict the bronchi, on stomach, stimulate the peristalsis and secretion, on liver, stimulate the release of bile, on gallbladder, contract the bladder. Sympathetic function on eye, dilate the pupil, on salivary gland, inhibit the flow of saliva, on heart, accelerate the heartbeat, lungs, dilate the bronchi, and stomach, inhibit the peristalsis and secretion, on liver, conversion of glycogen and to glucose. So on solar plexus, secretion of the noradrenaline and adrenaline, and bladder, inhibit the bladder constriction. Now I discuss what is autonomic drug. The drug that produce their therapeutic effects by mimicking the function of autonomic nervous system are called autonomic drugs. Neurotransmitters. Neurotransmitters are the specific chemical signal that release from the nerve terminals and responsible for communication between the nerve cells and between the nerve cell and effector's organ. This is release triggered by arrival of the action potential at the nerve ending. Type of neurotransmitter according to their action. Excitatory, glutamate, aspartate. Inhibitory, GABA, glycine. Both excitatory and inhibitory, acetylcholine, noradrenaline, histamine, prostaglandin, dopamine. Now I discuss criteria of ideal neurotransmitter. Number 1, it should present in the presynaptic neuron along with the enzyme synthesize it. Number 2, it should be released in the synaptic cleft following nerve stimulation. Number 3, its application should produce response identical to those produced by nerve stimulation. Number 4 is effects should be antagonized or potentiated by other substance which is similar alter effects of nerve stimulation. This diagram shows the release of neurotransmitter. Now, at first, action potential arrive at axon terminal, then voltage gated calcium channel open, calcium enter into the cell, calcium single to vesicle move to the membrane, dog vesicle release neurotransmitter by exocytosis, neurotransmitter diffuse across the synaptic cleft and bind to the receptors. Cholinergic neurotransmitter is acetylcholine. This diagram shows the synthesis, release and breakdown of acetylcholine. Choline acetyl transferase catalyzes the synthesis of the acetylcholine from the choline and acetyl-CoA. Then acetylcholine stored in vesicle. After action potential release of neurotransmitter, this neurotransmitter is binding to the receptors. Then acetylcholine degraded by the rapidly hydrolyzed by the acetylcholinesterase enzyme in the synaptic cleft. Then acetylcholine divided into the choline and acetate. This choline is taken by the neuron. This transporter is inhibited by the hemicholineum. This diagram shows the cholinergic transmission. Step 1, choline acetyl transferase synthesizes the acetylcholine. Acetyl-CoA synthesized in mitochondria and choline transferred into the neuron. Blocked by the hemicholineum. The block uptake by choline. Acetylcholine transport into the seminucleus vesicle. This transport can be blocked by the vesicle. Release of transmitter is calcium dependent, triggered by action potential. Acetylcholine release blocked by the botulinum toxin. This acetylcholine binds to the receptor. This acetylcholine is catabolized by the acetylcholinesterase enzyme and divided into the choline and acetate. Terminate of the action of the transmitter. The half-life of acetylcholine is very short. Acetylcholinesterase enzyme remain in the other tissue such as red blood cell and other enzyme butyrylcholinesterase or pseudocholinesterase enzyme. Thank you.